Good evening, Chair Bosin and members of the Judiciary Committee. My name is Megan Hunt, M-E-G-A-N-H-U-N-T, and I'm here today to present LB165. LB165 is a bill that you'll be familiar with if you were in the body last session. And if you were, I'm eager to bring it before you because I think with so many fresh faces in the body and changes in our committees and a growing coalition of bipartisan support we've built for this, we have another chance to get this law, to get this bill passed and made into law as the body intended last year. This is a bill that would allow the governing bodies of cities or counties, like a county board or a city council or a village board, to authorize syringe service programs in Nebraska. Last year, the 108th legislature passed that bill on final reading. The governor vetoed the bill and then successfully bullied and intimidated a handful of members into falling off on the veto override vote. I will share more about what happened since then, between then and now, but first I want to lay out the basics of the bill for those of you who need a refresher and for those of you people watching. LB165 would allow local jurisdictions, so cities, counties, or villages, to authorize public or behavioral health programs to distribute hypodermic needles or sterile syringes as part of public health efforts to reduce the spread of infectious diseases such as HIV and Hepatitis C. These syringe service programs, or SSPs, serve primarily as a place where people who inject drugs can do so safely and responsibly, and they can dispose of their used needles and receive new sterilized syringes and other equipment without causing a public safety risk. SSPs also typically provide referrals to substance use disorder treatment programs, screening, care, and treatment for viral hepatitis, HIV and STIs, overdose prevention and safer injection practice education, and supplies to prevent overdoses like Narcan, fentanyl test strips, and vaccinations for diseases like hepatitis A and B, wound care, referrals to social, mental health, primary care providers, and other services. When a person who injects drugs steps into an SSP, they help build long-term relationships with healthcare providers who are non-judgmental, who are going to help them get into a better place when they're ready to seek treatment for addiction. And research backed by the CDC shows that SSP participants are 4 to 5 times more likely to enter a treatment program and engage in long-term recovery, and 3 times more likely to stop using drugs altogether. This alone was the statistic that got so many people on board with this last year, and that I think, in my opinion, is one of the most compelling reasons that Nebraska needs to step forward and take this on. SSPs offer benefits not just to the participants that utilize the services, but to the broader communities that have them. Studies show that they reduce litter and the likelihood of unsafe used needles ending up in places like parks and playgrounds by providing a safe, penalty-free option for disposal. They protect first responders and law enforcement from needle stick injuries, and they protect communities from potentially dangerous infectious disease outbreaks. SSPs lower infectious disease spread, specifically HIV and hepatitis, by 50%. That's according to the Center for Disease Control. When advocates approached me about bringing this bill, I was surprised to learn that Nebraska's HIV infection rate is at its highest in over a decade. In the 3-year period from 2018 to 21, while the U.S. experienced about a 5% decrease in new HIV diagnoses, Nebraska saw a 26% increase in diagnoses. And since this date, since the date that I shared here, it has continued to rise as well. Rural areas were hit hardest. New cases in rural counties nearly doubled in 2021. Buffalo and Hall counties currently have the highest HIV infection rates. I've distributed a handout that shows the different infection rates across Nebraska, and you can see how this affects some of our own communities. I also have data about our individual counties and our individual legislative districts that I can share with you too. A generation ago, HIV was mostly known as the precursor to AIDS, which used to mean a death sentence. Today, with advances in medical science, we are at a place where there are very effective drug treatments available that can help people living with HIV from ever developing AIDS. With early diagnosis and treatment, many people with HIV go on to live long and healthy lives, but these drugs remain expensive. The average lifetime cost of treating a person with HIV is somewhere around $420,000. Conservatively, it can be a lot higher. And the majority of these individuals are on Medicaid. If we could prevent even 50 of those new infections in Nebraska at a cost of $420,000, which is a conservative estimate, that would work out to a $21 million savings for taxpayers. Hepatitis C is also trending upwards in Nebraska. In the last 5 years of available data, hepatitis C went up 400% in Nebraska. That's according to research from the Legislative Research Office. Hepatitis C is primarily contracted by sharing needles, syringes, or other equipment used to prepare and inject drugs. The passage of LB165 would save these people a lot of pain, save costs to our communities, and reduce the risk of transmission to others, thus improving public health in Nebraska as well. Other than the public health benefit of curbing disease, I want to talk about the opioid the opioid problem in Nebraska and how SSPs can help address it in a data-backed, non-punitive way that will not result in fuller prisons. We've all heard about the recent rise in the use of fentanyl and other opioids with the previous bill, for example. And we know the danger of overdose that can come with the use of these drugs, and we know that this danger is rising in Nebraska and across our country. Fentanyl is a cheap, extremely powerful opioid that can be lethal at very small doses. Overdose-related deaths in Nebraska have steadily increased across the last decade. From 2011 to 2021, overdose deaths increased by 176% in Nebraska. Opioid misuse is trending upwards in half of our local health departments, and the highest is in the Dakota County Health Department region. The Federal Behavioral Risk Factor Surveillance System Survey, grouping Nebraska's counties into 3 categories of large urban, small urban, and rural, shows that opioid misuse in the state is highest in the small urban counties. Fentanyl is becoming cheaper, more frequently trafficked into the state, and more widely available. People may inject it because of the powerful high it provides for a small cost. Some people do not intend to inject fentanyl, and they think they have a purer opioid that they're using, but it's been mixed or cut with fentanyl or other toxic substances by the supplier to save money. This can easily lead to preventable overdose fatalities. Synthetic opioids like fentanyl are the most commonly overdose-involved type of drug. Under LB165, Nebraskans who visit SSPs can receive overdose awareness, safer practices training, fentanyl test strips, the overdose reversal medication naloxone, referrals to treatment programs, all of these things instead of tragically passing away from another overdose in Nebraska. With LB165, we are simply removing the barrier at the state level to cities, villages, and counties that already want to adopt an SSP. It would be up to the local governing board to determine the parameters of its own program, who they want to administer it, if it's the public health department or a federally qualified health center, what their funding source will be, maybe a mix of federal and private grants, and if there's community support, they could leverage city dollars, that's up to the citizens, and any other ordinances they might want to pass to govern their SSPs are up to them. This bill is just the state of Nebraska getting out of the way and saying we value local control, and we are going to join the 45 other states that have operational SSPs. We will listen to public health and medical experts, and we will let those cities and counties give this a shot if they want to. Any of us with a basic understanding of how addiction works, and I know many of us here have personal experience with addiction, we know that it's very difficult for users facing addiction to simply stop on their own. It changes your brain chemistry in a lasting way. The truth is that many people are going to use until they either experience an overdose or get the help, resources, and education they need to recover. SSPs are a way to get people in the door and have a touch point to them getting the help they may not reach out for or have access to by other means. It's a way to reduce the harm of IV drug use now, while pointing users toward building healthier habits in the future. Now I'll touch back on where we left off last year. I'm very proud of the coalition of citizens and advocates, of behavioral and public and mental health practitioners, law enforcement, and medical experts we've built around this issue and helped us get the bill passed last year. And I was grateful for those in the body who listened to the public health experts and to the families in their districts who told them this is something that makes sense for Nebraska. This year, we also have a robust group of bipartisan co-sponsors, and I'm thankful for them. Governor Pillen's arguments against this bill were based on junk studies and fringe radical YouTube videos that go against volumes and volumes of peer-reviewed published research on how these programs have worked in other jurisdictions. I took that veto personally because it was not based on research or facts. But I've made a good faith effort in LB165 to address one of Governor Pillen's main concerns, and that was that kids would somehow be harmed by the existence of SSPs in Nebraska. So in this bill, we have explicit language saying SSPs cannot serve anyone under 18. This version includes language we worked on to win compromise with Speaker Arch and other conservatives to provide specifics about the services that SSPs will provide and where they can be located within a community. Much of the language was also informed by our state's top expert physicians in addiction psychiatry with UNMC and the Nebraska Medical Association. This bill is airtight, it's ready to go, and it simply gives the green light for city councils or village boards with the support of their constituents to figure out if and how they want to take this on. They can be as restrictive as they like, and they can pull the plug if the program isn't working as intended. Finally, with LB165, not only can we reduce potential harm experienced by those suffering with addiction and struggling, we can also honor and protect our first responders and law enforcement who are in our communities doing their best to protect us. We can protect our neighbors and fellow Nebraskans from disease outbreaks, and we can provide our fellow citizens with the care and resources they might need to enter recovery. Let's allow leaders of our local communities to make the choice about whether an SSP could be beneficial to the people they represent. Thank you, and if you have any questions, I'd love to take them, and there may also be people behind me who can answer them as well.
Are there any questions from the committee? You got off easy.
Thank you.
Yeah? Are you still wishing to testify in the neutral capacity? Senator Hunt, if you want to come up to close, and while she's making her way up, I will just, for the record, there were 36 proponent comments submitted, 45 opponent comments submitted, and no neutral comments submitted. Am I in the right bill? Yeah, sorry, I am.
Thank you again, colleagues on the Judiciary Committee. I have written notes here kind of in response to a lot of the questions that were asked of other testifiers, so I don't want to keep us here too long, but I hopefully can make sense of my own notes here. I really want to thank the testifiers who came here, who stuck around, especially even those who had to leave. I know that they will be contacting you, not necessarily for testimony on the record, but just to make sure that their expertise can also be considered as you make a decision about this bill in this committee. And I do want to thank Dr. Janicek for coming, even in opposition. I've always enjoyed working with him, and I thank him for his contributions to the state. And I understand when you're put in a position of coming in front of a committee just to do your job, so I appreciate that, and I could hear that in his testimony as well. Last year, of course, DHHS did not take a position on this bill. They had no position. And speaking about the figures that he shared about HIV diagnoses in Nebraska, the past decade average for HIV diagnoses in Nebraska per year is 81. In 2021, it was 107, and in 2023, it was 99. So still high, higher than average, not as high as we've seen it during the pandemic, but to say that, and I'm not putting words in his mouth, but what I received from that testimony was that maybe HIV isn't a big enough problem that we need to take, these low-cost, common-sense measures to address it. I don't know if I would say it's not a problem. I think that we still have higher than average rates of HIV in Nebraska, and we can see in the data that that's just statewide. That's not even drilling down into your individual counties and districts, where many of them are much, much higher than average. Let's see. I wanted to address Senator Storr's question right toward the end there. I don't think that DHHS would end up being in the position of having to administer this program or having to oversee it or fund it or anything, because all of these programs would be passed by individual health department, or they would be passed by individual, county boards, city councils, the local jurisdiction would have to pass that with the support of the constituents, basically. And each one of those organizations would decide how this is implemented. And so some would do that in cooperation with the public health agency. That would make a lot of sense. And all of these things would have to be funded by that entity. So this isn't about the state handing down funding for this. It's not about the state dictating how they're going to be implemented, except for the provisions in the bill. So, what you might see in one community could be very different from what you see in another community. And I'll also sort of touch on a few points around that issue too. Senator DeBoer asked one testifier if there's evidence that SSPs lead to more crime or drug use or less crime or drug use. And there is no evidence, according to the CDC, that having an SSP in a community leads to more crime or more drug use. With the SSP serving as a contact point for people who are using drugs and for people who are receiving naloxone, who are receiving treatment for opioid abuse, it actually reduces drug use. And we've seen that figure from the CDC as well, which said that people who use SSPs are 4 to 5 times more likely to enter treatment and 3 times more likely to stop using drugs altogether. So that in the data just speaks to the effectiveness of these programs. Also, one criticism that we always hear with bills like this is, we don't want to turn into Portland. We don't want to turn into San Francisco. This is going to turn Nebraska into New York. Take a breath, be serious. The city of San Francisco has a population of 8 million people. Nebraska just hit 2 million. It's apples and oranges. And if you live in a community that either doesn't have a very serious problem with opioid abuse, or your, city council or village board or county board decides that they don't want to implement an SSP, then you don't have to worry about this. If it's not a problem in your community, then you don't really have to worry about it. This bill is just there for places where it is a problem, where law enforcement has been reaching out, where communities do struggle, and they know that this is a solution, and they want the opportunity to use it. Yeah, I don't have to touch on that. There's a danger politically, right, when you disagree with the governor. And you have to kind of walk a tightrope of how hard you're going to disagree with the governor, how deeply you're going to get into just your opinion about how wrong they are and what the data says about how wrong they are. So I will leave that at that. Depending on how this goes in the committee, I can certainly share more studies and research with you guys. I appreciate that Dr. Janicek, the first thing he said when he sat down before the committee was, I don't deny that the evidence is there for SSPs. I don't deny that the evidence shows that SSPs are effective. What he didn't speak about on behalf of this administration is the continued cuts to behavioral health funding in Nebraska in the budget. Last year when he vetoed this bill, the governor said that we need to do more on this issue. We need to do more to address opioid epidemic in Nebraska. But it's clear that that was all talk, because this bill is a way to actually do more without any state obligation, without any funding from taxpayers at the state level. And when we see coming through the budget more and more cuts to behavioral funding, more and more funding for prisons, I just think that this is going to be a more cost-effective, humane, better for our communities, better for our families. We heard from family members today who have lost people who were important to them. This is going to be a waypoint to prevent the problems that we are seeing in Nebraska. So happy to take any other questions.
Questions from the committee? Senator Storer.
Thank you, Chairman Bosman. And thank you, Senator Hunt. I want to come back to the funding piece, just being very pragmatic.
Yeah.
What is your vision do you have any estimates of cost and where those dollars would come from?
Yeah, there are federal programs that are available to provide grants for programs like this, and there are lots of municipalities around the country that already use that. There's a federal funding available under the Federal Consolidated Appropriations Act of 2018. It can be used to support the administrative cost of SSPs, testing, education, and referrals. And then communities can also seek funding from other grants, foundations, nonprofits, private donors. And the local jurisdictions that choose to authorize these programs, they would be responsible for coming up with the funding. And that's, again, something that would be ultimately kicked to the voters, to the constituents. Just like we do here at the state level, people would come into these meetings, and I actually have no doubt that if Valentine wanted to implement an SSP, there would probably be people that came in opposition to that hearing. So the local elected officials there would have to weigh that and make a decision, not only about whether they want to do it, but how to implement it and fund it.
Sure, and in fairness, I think the perspective I'm coming at is just an illustration of the vast differences of the demographics and sort of how counties operate across the state of Nebraska. And so in our very rural counties, of which I represent, there is no infrastructure within individual counties, so they're not an individual health, they're part of a regional Department of Health, which does fall under DHHS as well. So that's kind of where my concern, I guess, is coming from in terms of how sometimes things evolve, and I've watched how sometimes programs, start as a really legitimately great idea, right? But end up becoming kind of another bureaucratic level.
Sure.
That does end up costing taxpayer money. But so that's the basis of my question.
I appreciate that, and I don't want that to happen either. And I appreciate your experience as a county board member, but we're not creating a state-administered program here. What we're doing is removing criminal liability in our paraphernalia laws and establishing a minimum standard and allowing localities the ability to create their own programs, which, but for this bill, they just could not do.
Thank you.
Senator Storm.
Thank you. Thank you, Senator Hunt. So maybe you can clarify, if this passes, this bill would pass, are people who are getting free needles passed out to them, are they required to participate in any kind of rehab program?
No, it would not require them to participate in treatment.
So they're not required. And then you made the comment that the population of San Francisco is 8 million. It's 800,000, which is equal to Omaha and Lincoln's population. So
I encourage you to look up the metro area of San Francisco.
okay, well, I just said San Francisco.
Thank
but
you.
Still, thank you.
Any other questions? That will conclude our hearing on LB 165.